Which activity represents secondary prevention? 1. A patient attends cardiac rehabilitation sessions weekly. 2. The school health nurse provides a program to the first-year students on healthy eating. 3. A 50-year-old patient with no history of disease attends the local health fair and has blood pressure checked. 4. A home healthcare nurse visits a patient's home to change a wound dressing. Answer 4. A home healthcare nurse visits a patient's home to change a wound dressing. Rationale. Secondary prevention focuses on individuals who are experiencing health problems or illnesses and who are at risk for developing complications or worsening conditions. The home health nurse changing the wound dressing is an activity that is focused on preventing complications. Much of the nursing care related to secondary prevention is delivered in homes, hospitals, or skilled nursing facilities. Educational programs and cardiac rehabilitation sessions are examples of primary preventive measures. Sally has decided to set aside 30 minutes a day to walk after work next week. Sally is in what stage of risk factor modification? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. E. Maintenance. Answer C. Preparation. Rationale. Preparation is making small changes in preparation for a change in the next month. According to Maslow's hierarchy of needs, which of these needs would a patient seek to meet first? A. Self-actualization. B. Self-esteem. C. Shelter. D. Love and belonging. Answer C. Shelter. According to this model, certain inhuman needs are more basic than others, i.e., some needs must be met before other needs, e.g., fulfilling the physiological needs before the needs of love and belonging. While assessing the behavior of a patient with a drug addiction, the nurse observes that the patient has abstained from taking drugs for the past 6 months and has been practicing healthy eating habits. Which stage of behavior change does the patient exhibit? 1. Contemplative. 2. Maintenance. 3. Preparation. 4. Action. Answer 2. Maintenance. Rationale. A patient who has abstained from drug use for the past 6 months and is following a proper health regimen is in the maintenance stage of behavior change. A patient in the action stage of behavior change will actively engage in change. A patient in the preparation stage will begin to change habits. A patient in the contemplative stage will consider making lifestyle changes for the next 6 months. A patient comes to the local health clinic and states, "I've noticed how many people are out walking in my neighborhood. Is walking good for you?" What is the best response to help the patient through the stages of change for exercise? 1. Walking is okay. I really think running is better. 2. Yes, walking is great exercise. Do you think you could go for a 5-minute walk next week? 3. Yes, I want you to begin walking. Walk for 30 minutes every day and start to eat more fruits and vegetables. 4. They probably aren't walking fast enough or far enough. You need to spend at least 45 minutes if you are going to do any good. Answer 2. Yes, walking is great exercise. Do you think you could go for a 5-minute walk next week? Rationale. The patient's response indicates she is in the contemplative state, possibly intending to make a behavior change within the next 6 months. The nurse's statement reinforces the behavior and provides a specific goal for the patient to begin her walking plan. Which are components of the health belief model? Select all that apply. 1. The likelihood that a person will take preventive action. 2. Individual's perception of the seriousness of an illness. 3. Individual's perception of susceptibility to an illness. 4. Individual characteristics and experiences. 5. Behavior-specific knowledge and effect. Answer 1. The likelihood that a person will take preventive action. 2. Individual's perception of the seriousness of an illness. 3. Individual's perception of susceptibility to an illness. Rationale. The components of the health belief model include an individual's perception of susceptibility to an illness, perception of the seriousness of the illness, and the likelihood that a person will take preventive action. Individual characteristics and experiences and behavior-specific knowledge and effect are components of the health promotion model, not the health belief model. A patient has a cold with mild fever and is advised to rest for 3 days. Which patient's statements would be classified under illness behavior? Select all that apply. 1. Praying may help me feel better. 2. Maybe I can catch up on a few of my favorite movies. 3. It's really bad. I have to stay at home, and it's boring. 4. I feel fine. I should go shopping. 5. I shouldn't cook dinner for my husband. I don't want him to get sick, too. Answer. 1. Praying may help me feel better. 2. Maybe I can catch up on a few of my favorite movies. 3. It's really bad. I have to stay at home, and it's boring. 5. I shouldn't cook dinner for my husband. I don't want him to get sick, too. Rationale. Illness behavior involves how people monitor their bodies and define and interpret their symptoms. A patient approaches the nurse to learn about complementary and alternative interventions for a headache. Which complementary and alternative interventions should the nurse suggest to the patient to help attain a good outcome? Select all that apply. 1. Radiation therapy. 2. Relaxation therapy. 3. Reminiscence. 4. Music therapy. 5. Drug therapy. Answer. 2. Relaxation therapy. 3. Reminiscence. 4. Music therapy. Rationale. Complementary and alternative therapies can be incorporated into the nursing care model for providing holistic care. These therapies promote the natural healing abilities of the body. Music therapy helps to provide a soothing environment. Reminiscence helps in relieving anxiety. Relaxation therapy helps to relax the body and mind. Drug therapy and radiation therapy are not alternative interventions. A couple approaches the nurse for counseling. The body mass index (BMI) of the husband is 32, obese. The BMI of the wife is 16, underweight. Both are unemployed and need financial support. On interviewing, the nurse finds that the husband snores loudly, which disturbs the wife during sleep. Which internal variable has an influence on the woman's sleep? 1. BMI of 16. 2. Employment status. 3. Snoring. 4. BMI of 32. Answer. 1. BMI of 16. Rationale. The body mass index (BMI) of 16 shows that the woman is underweight. It shows her poor nutritional status. It is an internal variable that can have an influence on her health and sleep. The BMI of 32 is her husband's health indicator, so it is considered an external variable. Other external variables are snoring and employment status. Stroke is a lifestyle disease. Which lifestyle factors may increase the risk of developing a stroke? Select all that apply. 1. Lack of immunizations. 2. Tobacco use. 3. Excessive sun exposure. 4. Physical inactivity. 5. Fast foods. Answer. 2. Tobacco use. 4. Physical inactivity. 5. Fast foods. Rationale. Fast foods, physical inactivity, and use of tobacco could all increase the risk of stroke. Fast foods have high fat content and increase the risk of atherosclerosis, which in turn leads to stroke. Physical inactivity may lead to obesity, which again promotes deposition of fats in the blood vessels, thus increasing the risk of stroke. Tobacco use accelerates the process of atherosclerosis and also contributes to increasing the risk of stroke. Excessive sun exposure can cause cancer. A lack of immunizations may leave one susceptible to diseases such as influenza and hepatitis. Which factors responsible for cerebrovascular disease are classified as lifestyle choices? Select all that apply. 1. Eating pizza for dinner every night. 2. Thromboembolic disease. 3. A history of diabetes. 4. A sedentary lifestyle. 5. Smoking 5 times a day. Answer 1. Eating pizza for dinner every night. 4. A sedentary lifestyle. 5. Smoking 5 times a day. Rationale: tobacco use increases the risk of cardiovascular disease. Therefore, a patient who smokes regularly will have a higher risk of cerebrovascular disease. A patient who has a sedentary lifestyle and does not walk frequently or do any physical activity will have a high risk of cerebrovascular disease. A sedentary lifestyle is a lifestyle choice and can be changed. A patient who eats pizza and foods with poor nutritional value may have a risk for cerebrovascular disease. Eating habits are also considered to be lifestyle factors. Although a patient with a history of diabetes will have a risk of cerebrovascular disease due to abnormal glucose regulation that affects the cerebrovascular system. This is a genetic and physiological factor. Likewise, a patient with thromboembolic disease will have inadequate blood circulation, which may cause cerebrovascular disease. But this is a physiological factor responsible for cerebrovascular disease, not a lifestyle choice. The nurse is teaching juniors about the health promotion model (HPM). Which components belong to the health promotion model? Select all that apply. 1. Likelihood that a person will take preventive action. 2. Individual's perception of susceptibility to illness. 3. Behavior-specific knowledge and effect. 4. Individual characteristics and experiences. 5. Behavioral outcomes. Answer 3. Behavior-specific knowledge and effect. 4. Individual characteristics and experiences. 5. Behavioral outcomes. Rationale: the health promotion model (HPM) was proposed by Pender. According to this model, health is a positive, dynamic state, not merely the absence of disease. Health promotion activities are aimed at increasing the well-being of patients. The components of HPM include behavioral outcomes, individual characteristics and experiences, and behavior-specific knowledge and effect. The behavioral outcome as a result of health promotional activities is the endpoint in HPM. The individual characteristics and experiences determine the individual's response to health promotion activities. The behavior-specific knowledge and affect are important in understanding and implementing health promotion activities. The individual's perception of susceptibility to illness and the likelihood that a person will take preventive action do not affect HPM. These components belong to the health belief model. Which is the desired outcome of the health promotion model? 1. Improving the physical, mental, and social health of all age groups. 2. Modifying the personality of a person. 3. Encouraging health-promoting behavior. 4. Healthy People 2020. Answer 3. Encouraging health-promoting behavior. Rationale: health-promoting behavior is the desired behavioral outcome and the endpoint in the health promotion model. Healthy People 2020 is a health initiative. Modifying the personality of a person is not a goal of the health promotion model. The health promotion model acknowledges that people are different, and each person is unique. Improving the physical, mental, and social health of all age groups is not included in the health promotion model. These are activities included in the primary level of preventive care. A professor at a nursing school asks students to give examples of secondary prevention. Which examples would the professor expect from the students? Select all that apply. 1. Immunization for influenza. 2. Rehabilitation activities. 3. Wellness education activities. 4. Treating diseases at an early stage. 5. Screening techniques of diseases. Answer 4. Treating diseases at an early stage. 5. Screening techniques of diseases. Rationale. Secondary prevention focuses on individuals who are experiencing health problems or illnesses and are at risk for developing complications or worsening conditions. It includes screening techniques and treating early stages of a disease to limit disability by averting or delaying the consequences of advanced disease. Primary prevention aimed at health promotion includes health education programs, immunizations, and physical and nutritional fitness activities. Tertiary prevention occurs when a defect or disability is permanent and irreversible. Activities are directed at rehabilitation rather than diagnosis and treatment. Which statement by a patient supports the nurse's conclusion that the patient follows a holistic approach of healing? 1. I am following prescribed medical therapies to lower the risk of heart attack. 2. I'm also using guided imagery and relaxation therapy for treatment. 3. I am following a perfect regimen of diet and exercise every day. 4. I'm implementing changes in my behavior for better health. Answer 2. I'm also using guided imagery and relaxation therapy for treatment. Rationale. A patient who follows a holistic approach to healing recognizes the natural healing abilities of the body and may prefer guided imagery and relaxation therapy. Traditional methods of healing may also be used. A patient who follows health promotion will practice healthy food habits and exercise to maintain proper health. A patient who follows the trans-theoretical model of change will practice proper behavior habits to promote healing. Patients who follow the health belief model have their own perceptions about illness and try to take action related to lifestyle changes to prevent the risk of illness. A patient comes to a rheumatology clinic with acute osteoarthritis. The patient's height is 167 centimeters, 5 feet 5 in, and weight is 75 kilograms, 165 pounds. The patient's body mass index (BMI) exceeds the average level. The nurse understands that the patient needs a tertiary level of preventive care. Which should the nurse suggest to the patient? Select all that apply. 1. Diagnostic tests. 2. Physical exercise. 3. Continuing medication. 4. Weight reduction. 5. Immunizations. Answer 2. Physical exercise. 3. Continuing medication. 4. Weight reduction. Rationale. The nurse should suggest that the patient reduce weight. This would help to prevent putting more pressure on the affected joints. Continuation of medicine is important because this will reduce the pain of osteoarthritis and prevent progression of the disease. Physical exercise helps to maintain movement of joints because stiffness of joints is a common problem experienced by patients with osteoarthritis. Immunizations are considered primary prevention. Diagnostic tests are secondary prevention. An elderly patient is admitted to a hospital for management of depression. The patient asks the nurse for permission to do meditation and breathing exercises for 15 minutes in the evening. The nurse has given the permission to do so. Which health model is reflected in this situation? 1. Holistic health model. 2. Restoration and rehabilitation model. 3. Health belief model. 4. Health promotion model. Answer 1. Holistic health model. Rationale. The holistic health model emphasizes that all dimensions of an individual should be considered, including emotional and spiritual well-being, for the total wellness of an individual. Therefore, the approach used in this case comes under the holistic health model. The health promotion model focuses on individual characteristics and experiences, behavior-specific knowledge and affect and behavioral outcomes. The health belief model addresses the relationship between a person's beliefs and behavior. Restoration and rehabilitation fall under tertiary prevention. The nurse is attending to patients in a postoperative unit. Based on the holistic model of care, which activities should the nurse encourage the patients to perform? Select all that apply. 1. Maintaining proper body image. 2. Fulfilling psychosocial needs. 3. Relaxation therapy. 4. Breathing exercises. 5. Praying with family. Answer 3. Relaxation therapy. 4. Breathing exercises. 5. Praying with family. Rational. In the holistic method, the nurse recognizes the natural healing ability of the body. The nurse combines conventional medicine along with complementary and alternative therapies, which are effective, economical, and non-invasive. Prayers with family members, breathing exercises, and relaxation therapy are techniques that help in healing the patient naturally using the body's own ability. Fulfilling the psychosocial need of the patient comes under Maslow's hierarchy model. Maintaining proper body image is not included in the holistic model. The nurse is teaching a group of student nurses about health belief models. Which components of the health belief model address the relationship between a person's beliefs and behaviors? Select all that apply. 1. Individual's perception of the seriousness of an illness. 2. Likelihood that a person will take preventive action against a disease. 3. Individual's perception of management of an illness. 4. Individual's perception of duration of an illness. 5. Individual's perception of susceptibility to an illness. Answer 1. Individual's perception of the seriousness of an illness. 2. Likelihood that a person will take preventive action against a disease. 5. Individual's perception of susceptibility to an illness. Rational. The first component of the health belief model involves an individual's perception of susceptibility to an illness. Once individuals understand that they may be susceptible to a disease, they may be able to perceive the seriousness of the problem. The second component is an individual's perception of the seriousness of the illness. The third component is the likelihood that a person will take preventive action. Perception of duration and management of illness are not part of this model. A 76-year-old patient has come to a clinic for a regular checkup. During the assessment, the nurse finds that the patient is a chronic smoker. The patient is not alcoholic but is allergic to milk and seafood. Considering the patient's age, screening tests for colon cancer are performed and the patient is advised to begin a high-fiber diet. The patient complains of pain in the legs. The Doppler study of the lower extremities reveals peripheral vascular disease (PVD). The patient is advised to exercise regularly. Which suggested interventions are included in primary prevention? Select all that apply. 1. Advising a high-fiber diet to prevent colon cancer. 2. Advising the patient to avoid milk products. 3. Encouraging the patient to exercise regularly. 4. Prescribing narcotic drugs for pain relief. 5. Counseling for smoking cessation. Answer 1. Advising a high-fiber diet to prevent colon cancer. 2. Advising the patient to avoid milk products. 5. Counseling for smoking cessation. Rationale. In primary prevention, measures are taken before the occurrence of disease or dysfunction. In this case, activities for primary prevention include counseling for smoking cessation, advising the patient to avoid milk products, and advising a high-fiber diet. Prescription of narcotics for pain relief is a secondary prevention, which is done after diagnosis. Encouraging the patient to exercise is a tertiary prevention against complications and disabilities related to peripheral vascular disease. A male patient has been laid off from his construction job and has many unpaid bills. He is going through a divorce from his marriage of 15 years and has been seeing his pastor to help him through this difficult time. He does not have a primary health care provider because he has never really been sick, and his parents never took him to a physician when he was a child. Which external variables influence the patient's health practices? Select all that apply. 1. Difficulty paying his bills. 2. Seeing his pastor as a means of support. 3. Age of patient 46 years. 4. Stress from the divorce and the loss of a job. 5. Family practice of not routinely seeing a healthcare provider. Answer 1. Difficulty paying his bills. 5. Family practice of not routinely seeing a healthcare provider. Rationale. External factors impacting health practices include family beliefs and economic impact. The way that patients' families use healthcare services generally affects their health practices. Their perceptions of the seriousness of diseases and their history of preventive care behaviors or lack of them influence how patients think about health. Economic variables may affect a patient's level of health by increasing the risk for disease and influencing how or at what point the patient enters the health care system. Based on the trans-theoretical model of change, which is the most appropriate response to a patient who states, "Me, exercise? I haven't done that since junior high gym class, and I hated it then." 1. I'd like you to ride your bike 3 times this week and eat at least 4 fruits and vegetables every day. 2. I understand. Can you think of one reason why being more active would be helpful for you? 3. Oh, I want you to walk 3 miles 4 times a week, and I'll see you in 1 month. 4. That's fine. I don't exercise either because I hate it too, and I don't think it's helpful. Answer 2. I understand. Can you think of one reason why being more active would be helpful for you? Rationale. The patient's response indicates that the patient is in the pre-contemplation stage and does not intend to change behavior in the next 6 months. In this stage, the patient is not interested in information about the behavior and may be defensive when confronted with it. Asking an open-ended question may stimulate the patient to identify a reason to change behavior. Nurses are challenged to motivate and facilitate change in health behavior when working with individuals. When taking care of patients, a nurse routinely asks if they take any vitamins or herbal medications, encourages family members to bring in music that the patient likes to help the patient relax, and frequently prays with her patients if that is important to them. The nurse is practicing which model? 1. Holistic. 2. Health belief. 3. Trans-theoretical. 4. Health promotion. Answer 1. Holistic. Rationale. The nurse is using a holistic model of care that takes a more holistic view of health by considering emotional and spiritual well-being and other dimensions of an individual to be important aspects of physical wellness. The holistic health model of nursing attempts to create conditions that promote optimal health. Nurses using the holistic nursing model recognize the natural healing abilities of the body and incorporate complementary and alternative interventions such as music therapy, reminiscence, relaxation therapy, therapeutic touch, and guided imagery because they are effective, economical, non-invasive, non-pharmacological complements to traditional medical care. Which of the following are symptoms of secondary traumatic stress and burnout that commonly affect nurses? Select all that apply. 1. Regular participation in a book club. 2. Lack of interest in exercise. 3. Difficulty falling asleep. 4. Lack of desire to go to work. 5. Anxiety while working. 6. Lack of interest in exercise. Answer 3. Difficulty falling asleep. 4. Lack of desire to go to work. 5. Anxiety while working. Rationale. Nurses are particularly susceptible to the development of secondary traumatic stress and burnout, the components of compassion fatigue. Symptoms include decline in health, emotional exhaustion, irritability, restlessness, impaired ability to focus and engage with patients' feelings of hopelessness, inability to take pleasure from activities, and anxiety. Which activity shows a nurse engaged in primary prevention? 1. A home healthcare nurse visits a patient's home to change a wound dressing. 2. A nurse is assessing risk factors of a patient in the emergency department admitted with chest pain. 3. A school health nurse provides a program to the first-year students on healthy eating. 4. A nurse schedules a patient who had a myocardial infarction for cardiac rehabilitation sessions weekly. Answer 3. A school health nurse provides a program to the first-year students on healthy eating. Rationale: primary prevention aimed at health promotion includes health education programs, immunizations, and physical and nutritional fitness activities. Primary prevention includes all health promotion efforts and wellness education activities that focus on maintaining or improving the general health of individuals, families, and communities. The nurse is developing a health promotion program on healthy eating and exercise for high school students using the health belief model as a framework. Which statement is related to the perception of susceptibility to an illness? 1. I've decided to start a walking club at school for interested students. 2. The statistics of how many teenagers are overweight is scary. 3. I'm worried about becoming overweight and getting diabetes because my father has diabetes. 4. I don't have time to exercise because I have to work after school every night. Answer 3. I'm worried about becoming overweight and getting diabetes because my father has diabetes. Rationale: the statement, I'm worried about becoming overweight and getting diabetes because my father has diabetes, indicates that the individual is concerned about developing diabetes and believes that there is a risk or susceptibility based on recognition of a familial link for the disease. Once this link is recognized, the individual may perceive the personal risk for diabetes. None of the other options recognizes a risk factor or susceptibility. A patient had surgery for a total knee replacement a week ago and is currently participating in daily physical rehabilitation sessions at the surgeon's office. In what level of prevention is the patient participating? 1. Primary prevention. 2. Secondary prevention. 3. Tertiary prevention. 4. Quaternary prevention. Answer 3. Tertiary prevention. Rationale: tertiary prevention involves minimizing the effects of long-term disease or disability by interventions directed at preventing complications and deterioration following surgery. Tertiary prevention activities are directed at rehabilitation rather than diagnosis and treatment. Care at this level aims to help patients achieve as high a level of functioning as possible. Despite the limitations caused by illness or impairment, this level of care is called preventive care because it involves preventing further disability or reduced functioning. A nurse is conducting a home visit with an older adult couple. While in the home, the nurse weighs each individual and reviews the 3-day food diary with them. She also checks their blood pressure and encourages them to increase their fluids and activity levels to help with their voiced concern about constipation. The nurse is addressing which level of need according to Maslow? 1. Physiological. 2. Safety and security. 3. Love and belonging. 4. Self-actualization. Answer 1. Physiological. Rationale: the nurse's actions address the basic physiological needs of nutrition, fluids, elimination, and oxygen. According to Maslow, basic needs must be met before meeting higher level needs. The teaching addresses the need for safety and security, the throw rugs, low lighting, and low stool are hazards that can cause falls in the elderly. Preventing falls is a priority safety issue for older adults. Physiological needs refer to the need for food, fluid, elimination, and so forth. Love and belonging refers to the need for relationships, and self-actualization is the need to feel fulfilled in life. According to the World Health Organization, WHO, what is the definition of health? 1. Total absence of all diseases, disorders, and syndromes. 2. Absence of symptoms and signs with normal lab reports. 3. Complete physical, mental, and social well-being. 4. Being free from illness or injury. Answer 3. Complete physical, mental, and social well-being rationale. The World Health Organization (WHO) defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Health is not only the state of being free from illness or injury or the absence of signs and symptoms. Health does not refer to the state of total absence of all diseases, disorders, and syndromes, but also includes components of mental health and spiritual health. When illness occurs, different attitudes about the illness cause people to react in different ways. What do medical sociologists call this reaction to illness? 1. Illness prevention. 2. Health promotion. 3. Illness behavior. 4. Health belief. Answer 3. Illness behavior rationale. Illness behavior involves how people monitor their bodies, define and interpret their symptoms, take remedial actions, and use the resources in the healthcare system. Personal history, social situations, social norms, and past experiences can affect illness behavior. Health beliefs are a person's ideas, convictions, and attitudes about health and illness. Positive health behaviors are activities related to maintaining, attaining, or regaining good health and preventing illness. Illness prevention motivates people to avoid a decline in health or functional levels. After a class on Pender's health promotion model, students make the following statements. Which statement does the faculty member need to clarify? 1. The desired outcome of the model is health-promoting behavior. 2. Perceived self-efficacy is not related to the model. 3. The individual has unique characteristics and experiences that affect his or her actions. 4. Patients need to commit to a plan of action before they adopt a health-promoting behavior. Answer 2. Perceived self-efficacy is not related to the model. Rationale. Within the model, perceived self-efficacy is one of the behavior-specific cognitions in effect. The behavior-specific cognitions have motivational significance within the model. A nurse is presenting a program to workers in a factory covering safety topics, including the wearing of hearing protectors when workers are in the factory. Which level of prevention is the nurse practicing? 1. Primary prevention. 2. Secondary prevention. 3. Tertiary prevention. 4. Quaternary prevention. Answer 1. Primary prevention rationale. Primary prevention is aimed at health promotion and includes health education programs, immunizations, and physical and nutritional fitness activities. It can be provided to an individual and includes activities that focus on maintaining or improving the general health of individuals, families, and communities. It also includes specific protection, such as hearing protection in occupational settings. Which statement made by a nurse shows that the nurse is engaging in an activity to help cope with secondary traumatic stress and burnout? 1. I don't need time for lunch since I am not very hungry. 2. I am enjoying my quilting group that meets each week at my church. 3. I am going to drop my gym membership because I don't have time to go. 4. I don't know any of the other nurses who met today to discuss hospital-wide problems with nurse satisfaction. Answer 2. I am enjoying my quilting group that meets each week at my church. Rationale. Nurses experience secondary traumatic stress and burnout. Personal strategies to help prevent or cope with secondary traumatic stress or burnout include healthy eating, making time for yourself to pursue personal interests, getting plenty of sleep, and regular exercise and relaxation. The nurse assesses the following risk factors for coronary artery disease (CAD) in a female patient. Which factors are classified as genetic and physiological? Select all that apply. 1. Sedentary lifestyle. 2. Mother died from CAD at age 48. 3. History of hypertension. 4. Eats diet high in sodium. 5. Elevated cholesterol level. Answer 2. Mother died from cat at age 48. 3. History of hypertension. 5. Elevated cholesterol level. Rationale. Genetic and physiological risk factors include those related to heredity, genetic predisposition to an illness, or those that involve the physical functioning of the body. Certain physical conditions, such as being pregnant or overweight, place increased stress on physiological systems, e.g., the circulatory system, increasing susceptibility to illness in these areas. A person with a family history of diabetes mellitus is at risk for developing the disease later in life because of a hereditary and genetic predisposition to the disease. A patient with a 20-year history of diabetes mellitus had a lower leg amputation. Which statement made by the patient indicates that the patient is experiencing a problem with body image? 1. I don't go out very much because everyone stares at me. 2. My wife has taken over paying the bills since I've been in the hospital. 3. I've been attending church regularly with my wife since I got out of the hospital. 4. I just don't have any energy to get out of bed in the morning. Answer 1. I don't go out very much because everyone stares at me. Rationale. The amputation resulted in a change in physical appearance that caused a change in body image. Reactions of patients and families to changes in body image depend on the type of changes, e.g., loss of a limb or an organ, their adaptive capacity, the rate at which changes take place, and the support services available. When a change in body image results from an event such as a leg amputation, the patient generally adjusts in the following phases: shock, withdrawal, acknowledgement, acceptance, and rehabilitation. The statement indicates that the patient is in the stage of withdrawal. The nurse works in a special care unit for children with severe immunology problems and is caring for a 3-year-old boy from Greece. The boy's father is with him while his mother and sister are back in Greece. The nurse is having difficulty communicating with the father. Which action should the nurse take? 1. Search for help with language interpretation and develop an understanding of the cultural differences. 2. Have another nurse care for the boy because maybe that nurse will do better with the father. 3. Ask the manager to talk with the father and keep him out of the unit. 4. Care for the boy using hand gestures as if he were from the local community. Answer 1. Search for help with language interpretation and develop an understanding of the cultural differences. Rationale. The nurse needs to understand how the Greek culture impacts the father's health beliefs and communication with healthcare providers. Cultural variables must be incorporated into the child's plan of care. Cultural background influences beliefs, values, and customs. It influences the approach to the health care system, personal health practices, and the nurse-patient relationship. Cultural background may also influence an individual's beliefs about causes of illness and remedies or practices to restore health. Utilizing hand gestures is not a genuine way to communicate with a patient from another culture. Parents are integral components in the health and healing of their children. It is not appropriate to pass the child to another nurse unless that nurse has a better understanding of the Greek language and culture. Which intervention comes under active strategies of health promotion? 1. Fortification of cereals with vitamin A. 2. A weight reduction program for obese people. 3. Fluoridation of municipal drinking water. 4. Fortification of milk with vitamin D. Answer 2. A weight reduction program for obese people. Rationale. Active strategies of health promotion require a person to be actively involved in the measures taken to improve a condition and reduce the risk of disease. Therefore, a weight reduction program for obese people is an active strategy. In passive strategies of health promotion, individuals gain from the activities of others without acting themselves. Interventions such as fortification of milk with vitamin D, fluoridation of municipal drinking water, and fortification of cereals with vitamin A are classified as passive strategies. A patient registered at the local fitness center and purchased a pair of exercise shoes. The patient is in what stage of behavioral change? 1. Pre-contemplation. 2. Contemplation. 3. Preparation. 4. Action. Answer 3. Preparation. Rationale. The individual is in the preparation stage, making small changes toward preparation for a change in the next month. In this stage, the patient believes that the advantages outweigh the disadvantages. After evaluating a patient's external variables, the nurse concludes that health beliefs and practices can be influenced by A. Emotional factors, B. Intellectual background, C. Developmental stage, D. Socioeconomic factors. Answer D. Socioeconomic factors, rationale, emotional factors, intellectual background, and developmental stage are internal factors, not external factors. Internal variables, developmental stage, intellectual background, perception of functioning, emotional factors, spiritual factors, external variables, family role and practices, social determinants of health. You will use the concept of primary prevention when instructing a patient to A. Get a flu shot every year. B. Take a blood pressure reading every day. C. Explore hiring a patient with a known disability. D. Undergo physical therapy following a cerebrovascular accident. Answer A. Get a flu shot every year. Rationale. Primary prevention, true prevention that lowers the chances that a disease will develop. Secondary prevention focuses on those who have health problems or illnesses and are at risk for developing complications or worsening conditions. Tertiary prevention occurs when a defect or disability is permanent or irreversible.